Connie Bowman here at the Women's Acupuncture Center in Clarksville, Maryland. And I'm here with Janet Althen, who is an acupuncture practitioner. And she's, did I say that right? Practitioner.
Acupuncturist, yes.
That's hard to say. Acupuncturist. She's awesome. And she's been here for a while doing acupuncture here in this place. And she specializes in women's issues, correct?
Right. And as the Women's Acupuncture says, we specialize in all those special things that we women are dealing with as very, very hormonal creatures.
And I can attest that women literally flock to Janet to achieve some balance in mind, body, and spirit. And so what do you think is the primary reason a woman will come to you for an acupuncture treatment?
Well, women come in for all kinds of issues. The normal kinds of things that people associate acupuncture with, like pain, things that have to do with bad knees, arthritis, more along those lines. But then in addition to that, what the women are coming in for and what they're really getting great relief from are hormonal imbalances, menstrual cycle difficulties. I work a lot with fertility, digestive issues. So these are the kinds of things that acupuncture is extremely effective with and that I've been working with lots over the last 5 years. So a young girl who's having lots of pain and difficulty with her menstrual cycle will greatly benefit from it. A young woman who is wanting to become pregnant and it's not quite happening, again, greatly benefit from it. And then the older woman who's transitioning in that whole perimenopausal stage,
the change
that can be challenging, will also benefit. So the hormonal balance that is achievable via acupuncture is really quite amazing, and it's not something that most women know about.
And it's something that we can do without traditional pharmaceuticals.
Right, or in conjunction with, but thereby allowing you to take less, quote, medication if in fact you had to go that route. You know, we all want to not quite do that, and sometimes we have to. It just depends on.
Sometimes we just need a little help along the way. Right.
Exactly.
Do you have any really great success stories? Let's talk a little bit about infertility. I mean,
well, I have lots of baby pictures in my office.
Aww.
Oh yeah, wonderful, wonderful, wonderful. I remember one patient specifically who had gone for several rounds of IVF treatments, which is the in vitro fertilization, which is very, very difficult emotionally, physically, not to mention financially. And she had gone down for I don't know how many of those, 4 or 5 or so, and was just absolutely physically and emotionally spent. And wanted to just take a break from all that and was very depressed, and so she came in for acupuncture treatment, and I think it was somewhere around the 10th week she was pregnant.
Aww.
And basically what I was doing with her, she had actually had abdominal surgery, and this is something that I work with also with women. I do scar treatments. Anytime you have a surgery and you cut across the lines of energy, which is the meridian system in acupuncture, things get scattered. And she had had abdominal surgery when she was younger, much younger. As a teenager, I believe she had an ovary removed. And I worked a lot on that to restore those connections. And I really believe that that's what allowed her body then to come back into its energetic balance and then allow the pregnancy to happen on its own.
Oh, that's fantastic.
So, yeah,
Nice
I have lots of babies there that you know people thought they would never.
Did any of them name their babies after you? Not yet.
They're all boys. All boys. So if you want a boy, you need to come in. I have very few girls, couple girls here and there, but I tell you, they're all boys for some reason. So no, nobody's named their children.
What's wrong with a boy named Janet?
No, I don't know.
Well, you know, one of the things that's so amazing about acupuncture is the sense of relaxation that you get when you get in there. What is that all about? And I mean, I think it really does carry over into our everyday life. You know, when you're on a regular acupuncture regimen, it's sort of like meditating, I think. How does that work, and what's that all about?
Yeah, well, when your energy is balanced and it's flowing smoothly in your body, then everything flows. You know, all the messages are being carried appropriately. Nobody's screaming and yelling. You know, I remember Bob Duggan, who's the president of Thai Sophia Acupuncture School, describing the energies in the body as being a Thanksgiving table full of all the relatives.
Oh.
And just a real sort of like nice, peaceful, lovely dinner you can imagine instead of the dysfunctional, you know,
right.
Thanksgiving typical sometimes situation that where somebody's screaming and who's drinking a little too much over here, but, those kinds of things. So that the energy when it's flowing in the body smoothly, everything is easier.
Just calms down.
Everything calms down. And when you're calm, then you can deal with things easier, and it snowballs in that nice, calming way.
Well, it's also very nice. Your treatment rooms are so comfortable and beautiful, and the nice soft music, that's always nice. And for a woman to come in here and just have an hour to herself with no interruption, I mean, that in itself is a break. Yeah.
Unfortunately for women, one of the things that I see clinically a lot, and it's been referred to as epidemic proportion these days, is undiagnosed, misdiagnosed, undertreated thyroid issues along with adrenal fatigue. And it's an area that I've become very knowledgeable about, and I'm often coaching my patients about the correct kind of testing to get, which kind of doctors to see. And these are the women who have continuing fatigue. They are defined as maybe perimenopausal, put on antidepressants, told it's menopause, etc., when in fact they do have underactive thyroids, but they show up as, quote, normal when they go to their regular doctor and have a sort of general testing done. So I have become sort of an expert in it, and am very good at helping women to get the right care and go to see the right practitioner so that these underlying conditions can be addressed.
So if a patient comes to you and you suspect that they may have thyroid or adrenal issues, will you treat them in conjunction with their traditional doctor?
Absolutely. So they'll be getting acupuncture treatment. I'll be using light therapy, which, as we mentioned before, addresses the endocrine system. And I also know which tests women should get so that they're sure they don't have a thyroid issue and or an adrenal issue. So most doctors just do a preliminary thyroid panel and they don't test for exactly the right thing. So many women are undiagnosed, misdiagnosed, and they suffer. Really.
Needlessly.
Right. And many are put on antidepressants. They cannot function. The fatigue is debilitating. And that can also, is found a lot with concurring adrenal fatigue, which is another situation where acupuncture comes in by providing de-stressing and allowing them to get deeper sleep, and so those adrenals can heal. I recommend certain supplements that I am well versed in and know that they're effective in rebuilding these glands. And then women also have to rule out, is there an underlying autoimmune situation?
Right.
Because that's a possibility, and there are probably about 30% of thyroid issues are autoimmune in nature. So that's another area of coaching that I get involved in, and how to calm that whole system down.
So you help guide women through the maze of not only alternative or complementary medicine, but also traditional medicine.
Right, the appropriate.
Sometimes it's hard to know where to go.
Exactly.
And for more information, you can go to Janet's website, which is
womensacupuncture.net.
womensacupuncture.net. Thank you, and I think it's time for my treatment. What do you think?
I think so. Let's go.
All right.